lovely. I'm Dr. Stephanie, one of the rheumatologists here. Lovely to meet you. So, you're here today because I've had a referral from your GP. Okay, they are concerned about psoriasis and chronic fatigue and pain. Is that right? Yeah. I see that you've also been referred to a dermatologist. Have you seen them yet? Okay. Okay. Right. That's fine. Okay. I will have a little look myself, so don't worry about that. So, I do have some questions to go through and exams to do. Alright, so before we get into that, I do need to confirm your full name, please. And your date of birth. Okay, that's great, thank you. So, could I start by taking your occupation? Thank you. Are you in any kind of education at the moment? Perfect. Right, so could you tell me a little bit about your medical history, please? Have you got anything that I need to be made aware of? So whether it was past or present conditions, okay? Yeah. And has the migraines been looked at? Okay. Right. Okay. No problem. Are they quite regular? What kind of symptoms do you experience when you have a migraine, and where exactly do you experience the pain? Okay. Is that quite often that you experience those symptoms? Okay. Do you notice anything else at all at the time that you've got a migraine? Have you noticed any pain anywhere else, or any swelling or anything? Okay, and where's that? Okay. Would you say that's all the time? Right. Do you take anything for the pain at all? Okay. And nothing works? Alright. That's fine. Okay, and anything else? Perfect. Right, I just want to ask about your family history as well. Is there anything in your family that I need to be made aware of? Is there anything hereditary? Okay. Is there any known arthritis in your family or any chronic pain issues? And what about any joint hypermobility syndrome? Okay. Okay. Right, are you on any medication? And if so, could you just tell me what you are taking, why that is, And how many milligrams, please? Okay. Okay. And how long have you been on that one? Okay. Okay. And again, how long on that one? Right. Anything else? Okay. Right, that's fine. So none of them are quite recent medication, aren't they? So yeah, so quite a few years, which is fine. Do you find that any of your symptoms have developed since being on any of these medications, or would you say it hasn't really made a difference? Okay, that's really good. We have to check because sometimes the medication that we're on can give us all sorts of different side effects and things like that. So sometimes we experience things and it's actually the medication that's causing that. So that's also, you know, a good question to ask. All right. Okay. Do you have any allergies? Okay. Great. Thank you. Right. Do you drink enough fluids, preferably water? Okay. Could you tell me what kind of lifestyle you have? So would you say it was quite busy, hectic, stressful, relaxing, slow, anything like that? Okay. Yeah. And do you get some time to relax? Okay. Okay. Do you drive? Okay. That's fine. What is your diet like? Do you have any diet requirements, such as are you a vegan, vegetarian, or do you have like gluten-free or anything like that? Okay. Would you say it's quite a varied diet? Good. That's really good. I will get you to pop on the scales in a moment, all right. Do you manage to get any exercise? So when I mean exercise, I mean, do you go to the gym or do you do any cycling, running or anything like that that's particularly aimed at cardio? When you do any working out, do you get any pain anywhere in particular? And how are you the day afterwards? Okay. Is that all the time? Okay. So when we do work out, we can experience some aching and a bit of pain and things like that. That is perfectly normal. But do you experience anything that's not quite normal? Would you say quite extreme pain anywhere in particular? Or any other kind of sensation? And is that all the time? Okay. And I suppose then that kind of stops you wanting to do that, doesn't it? Yeah, that's understandable. It is good to try to get gentle exercise when you can, okay, because it's going to help keep us flowing and moving. Obviously, it's good for our heart and things like that, but it's also good for our joints and our muscles and things. We don't want to seize up, and we have to kind of fight through it to help make it better. Okay, I do have quite a lot of patients that struggle to do that and they choose not to, and that's totally their choice, and I respect that. Okay, and they feel that doing any of the exercise actually makes them a lot worse. Also, driving quite a while as well. I don't know whether you experience any pain or anything like that if you drove for quite a while. Okay, and how many hours are we talking, or minutes? Okay. And what does that feel like? Okay. Right. Is that pretty much all the time? Yeah. Okay. It's not a problem. Okay, don't worry. We'll get to the bottom of this, okay, I assure you. Now I need to know about your mental health. Okay, so please forget the stress side of things at the moment. Okay, I'm particularly talking about your mental health. So, if you are diagnosed with any condition, I need to be aware of that, okay? And I just need to know in general, even if you aren't diagnosed with anything, how you are feeling. Okay. So when were you diagnosed with that? Right, so quite a long time. Okay. And when was that? Was that at the same time? Okay. Okay. And have you experienced any trauma in your life at all, however big or small? Okay. All right. And have you been diagnosed with anything like PTSD? Okay. All right. Is there anything else? Okay, do you see anybody professionally? A psychiatrist or a psychologist or a mental health nurse? And how often? Okay. When was the last time? Okay. Would you say you could do with seeing somebody? Hospital for a review? Okay. I'll put that in the letter to the GP. Okay. It's also very important that we keep up to date with our mental health checks as well as our physical checks, okay? It's very important. And sometimes there's quite a crossover between chronic pain and mental health issues, okay? It is very easy to ignore a mental health problem, and they can't be ignored. You are diagnosed with several conditions, so to me that should be monitored. Okay. I take it you haven't spoke to your GP about any of the mental health side of things for a while. Okay, when did you last have a medication review? Okay. So I'd like a medication review with the GP. Okay, and I think that we should have another review for your mental health as well. So what I'm thinking, if your GP can do your medication review and the mental health review, and then I'm going to recommend that they send you over to a psychiatrist or a psychologist just to have a little bit more of an in-depth assessment. Okay, just to make sure that everything's okay. All right, because I am aware that you're struggling quite a lot physically, and that could be having a negative effect on your mental health. All right, so just need to make sure that you're looking after your mind as well as your body. Don't worry, I will sort that out for you. Okay. Also, please don't be afraid to ask the GP for a review or for some help, okay, if you're noticing that your mood's dropping, if your anxiety's rising, or if you know that there's something not quite right, okay, or you feel that you want your medication looking at or something like that, please do ask. That's what they are there for. All right, please don't ignore it. Okay. Wonderful. So how many hours a night do you sleep? Is that straight through? And how long do you think it takes you to get to sleep? Okay. Is that the same every night or does it differ? Okay. Would you say you can't quite fully shut your mind off when you're in bed? Okay. And any of the pain and other symptoms that you get, does that keep you awake? Okay. That's totally understandable. Okay. So in the morning when you wake up, do you feel refreshed or do you still feel really tired, like you haven't slept? Okay. And what about the pain? Yeah. Okay. I totally get that. Yeah. Okay. And would you say it wears off once you, say, had some breakfast or something, or does it continue through the day? Right. Do you notice any triggers at all? So, is there anything in particular that will trigger off your symptoms? I get with the exercise and the driving, but is there anything else in particular that you've noticed? Okay. Yep, that's fine. But in general, you'd say it's not necessarily something you can put it down to. Yeah. Yeah, so you can't always pinpoint it. Okay. Is there anything that makes it better? Right. Okay. So you do try quite a bit. Okay. All right. Okay, don't worry. Okay. Could you just tell me your symptoms exactly, please? So, what are the things that you suffer with now? However big or however small, okay? If you think it might be stupid, please just tell me, okay? Because I can guarantee you it isn't stupid and it will be relevant. Okay, so when you're ready, and I will just write. Okay. And whereabouts? Okay. What about touch? Is there any areas in particular that would say quite sensitive to touch? Okay. Okay. Anything else? Okay. I'm assuming you haven't had any x-rays or any scans or bloods or anything like that done yet? Yeah, I didn't think so. Okay, that's fine. Right. Do you take recreational drugs? Do you smoke? And what about alcohol? Caffeine? Okay. Okay. Okay, could I get you just to stand on those scales there for me? Thank you. Okay, that's perfect. Thank you. You can go back now. That's perfect. Excellent. And how tall are you, please? Okay, just check that. Okay, that's fine. Wonderful. Okay. First of all, okay, if I could get you to take this bottle and go and do me a urine sample, please, okay? The toilets are just down the corridor there. Alright, so there you go. Okay, I'll see you in a moment. Oh, hello. Yeah, just come and take a seat and I'll pop some gloves on. Okay. You okay? Good. Okay, thank you. going to just leave that on the side a moment. Okay. Perfect. It's all clear. No issues with your urine. Okay, what I need to do now is do a few other tests, okay? Alright, so could I get you to stand up for me and just stand as you would normally, okay? Okay, could you put your feet together and just stand for me? Okay, as you are, can I just get you to pop your feet like that for me? Okay, just do it several times. Okay, it's fine. And just stand back normal again. Okay, now your feet are like so. Instead of going that way, can you do that for me? Okay, can you do that several times? And relax for me and stand normal. Great. Can you stand with your legs further apart for me? That's it, quite wide. Okay, can you stand back normal? Okay, thank you. Right, can I get you to put your arms right out for me? And just hold them there. Okay, can I get you to pop your arms down? And now raise them right up for me. And just do that a few times like so. Okay, relax. Okay. All right. Can I get you to stand on one leg for me? Just try to hold your balance as much as possible. Okay, can we swap into the other side? Okay, relax for me. Good. Okay, can you stand with your legs so far together? And I just want you to go up, down, so bend your knees for me. Okay, do it several times for me, gradually, not too fast. Stop. Is that quite uncomfortable? Whereabouts? Okay, that's fine. Relax for me. Okay. Can I get you to jump on the spot for me? Keep going for me. Okay, stop. How's that feel? Okay. Right. Could you hop, please, this side first? Okay, the other side. And relax. Okay. Can I now get you to just walk as you would normally right across the room for me? Okay, take it steady, not too fast. Okay. That's it, just stop there for me. Could you turn around? Great. And come back to me. Perfect. Okay, thank you. Okay, I just need you to go across again, but could you just do one foot in front of the other like so? Okay, you don't need to go as far this time. All right. Okay, when you're ready. That's good. Bit wobbly. Okay, stop for me. Okay, could you walk backwards, but just normally? Okay. Doing well. Okay, relax for me. Thank you. Perfect. Okay. Right, I'm just going to test your reflexes. Okay. So if you could just sit back there for me, just hang your legs right down. Okay. Right. So this arm, if I could get you to literally put it like this in that position for me, can you just do that? That's it, like so. Great. Okay, just relax, okay? Okay, can I get you to do exactly the same this side? Okay. Okay, relax your legs for me, and I'm going to do exactly the same on your legs. Okay. Can I just get you to just stretch your leg out for me? This side. Okay, I'm just going to hold the knee. Could you move again? Okay, relax for me. Okay, so I'm going to do that again. this side. Can I get you to move your leg as you did the other side, please? Okay. I'm just going to hold the knee. I'm going to do the same again. Okay, relax for me. Perfect. Please relax. What I need you to do now, my love, see over there, if you could just get that gown for me and just draw the curtain, and if you could take everything off apart from your pants, please. Okay, pop the gown on for me, and then you can come back. Yeah, all right, thank you. Okay, you're done. Great, thank you. Okay, are you comfortable? All right. Okay. What I'm going to do is feel across here, okay, and I'm going to push down your shoulders. All right. Okay. Okay, I'm going to push down. Can you shrug up for me? Okay, relax. Okay. If I can get your hand and you just push against mine. Okay? So you push. Okay? Same that side. Good. Relax for me. Okay. What I need to do now is just have a check round and have a feel of different areas on your body. Okay, and I'm going to be tapping and touching certain areas, and I just need you to tell me what you feel. Okay, and I would like to have a look at your fingernails, if that's okay first. Okay, thank you. Okay. Can I have a look in the inner elbow as well? Thank you. All right, hand this side. Okay, and the inner elbow. Okay. All right, that's fine. And if you could just pop your foot on there for me, thank you. Okay, while I'm here, I'm just going to feel around the ankle. Okay. You see, you just keep the foot there for me. How does it feel there? Okay. What about there? Okay. Okay, can I get you to just scrunch your foot like that for me? Relax. Okay, I'm just going to hold the foot and then you just move it for me. That's it. Gently side to side. Okay, up and down. Bring that right back and right forward. Okay, thank you. If you just relax. Just going to look behind the knee. How does that feel? Okay, that's fine. Okay, relax down there for me. And I need you to do the same this side, so if you could pop your foot there for me. Thank you. Okay, I'm just going to feel round, okay? How's it feel there? Okay. What about that bit? Okay. Okay, can I get you to move your foot for me, left to right? Okay. Up and down. Good. Can you scrunch for me? Good. Okay, I'm just going to check behind the knee. How does that feel? Good. Okay, just relax for me. Okay, I'm just going to pop some pressure around your ankles and around your knee area. Okay? Okay, just keep your foot right there. Tell me exactly how that feels. Okay, your knee. Okay. Same again this side, my love. How's that? Okay, your knee. Okay. Now I'm going to get your arm, okay? Keep it there. How's that feel on your elbow? Your wrist. Okay. What about that if I put pressure on it? Alright, okay. Now release. Okay. going to scrunch now. How's that? Okay, could you just do that for me now? That's it, just scrunch right up. Release. Okay. Okay, this side, my love. Thank you. How's that? Okay, wrist. How's that? What about on hold? Now release. Okay. Okay. Okay, I'm just going to scrunch. Okay, now if I can get you to do that for me. That's it, we can do that. Great. Okay, relax for me. Okay, you stay there for me. I'm just going to check around here. Okay? Just let me know what you feel. Okay. Okay, I'm just going to push. Right. How's that feel? Okay. There. Okay. Okay, I'm just going to swipe across like so. Okay, and rub all the way around here. Okay. Right, can I get you to lie right back for me? Okay. Okay. If you could just tell me what you feel. Okay, can I get you to sit up for me? Okay, I'm literally just going to feel around your upper shoulder at the back, okay? How's that? Okay. What about there? Okay, so tingling and burning. This is very light touching. How does that feel? Okay, that's fine. Okay, I'm going to go right up the base of your head, okay? How's that? Anything there? Okay. Is it always quite swollen in that area? Yeah. Okay, could you sit right up for me? Sit nice straight back. Okay. Great. Just relax for me. Okay, stay there. Any pain here? Okay. Okay, just relax for me. Okay, if you wouldn't mind going back to the changing room and just putting your normal clothes back on. Alright, and then you can come back over. Alright. right in there. Good. Okay. All right. Good. I'm just going to get ready for your blood test now. Okay, so what I'm testing for is I'm going to look at your iron, full blood count, obviously, liver, kidneys, rheumatoid arthritis, hormone levels, glucose, and a few other bits and bobs, okay? So this is just to rule out anything else, okay? I know what's going on, alright? But these are just a few of the things that I need to just check and make sure of. I'll just check this arm, please. Yeah, that's fine. Just clean the area. Okay. Let's do some pumps for me. Okay. That's perfect. Okay. Right, so I feel a sharp scratch now. Just keep very still for me. There we go. Very easy. Okay. That's brilliant. Nearly done now. Okay. Pressure right there. Not too bad. Good. Okay, we just pop a bit more pressure there for me for a moment. Thank you. Great, that's that done. You look. Perfect. Let me just pop this on. Great. Okay. Right, to get all that sent off. Okay. Right. Let me tell you what's going on. Okay. Right. You are definitely suffering with chronic fatigue syndrome. Okay. That's where you're experiencing the trouble sleeping, feeling overtired, not feeling refreshed, and all sorts of other kind of groggy feelings that you're having. Okay, and I don't know whether you've heard of this, but have you heard of fibromyalgia? Okay, well, it appears to me that you've definitely got that. Got the classic symptoms and where your pain is, how you're experiencing the burning, the tingling, all sorts of different sensations, the really sensitive skin to touch when you get your flu-like symptoms, your aches, your pains, the way you feel in the morning, everything like that, everything that you've told me. With the migraines, I think they are connected, swelling and everything like that. Okay, I'm going to give you some information. All right, so let's get out there. So here is an information leaflet about chronic fatigue syndrome. Okay, here is a big leaflet on fibromyalgia. Okay, so it is a central nervous system disorder. Okay, we rheumatologists diagnose rather than a neurologist. Okay, but sometimes there can be a question whether it may be Lyme's disease or MS. So what I'm going to do is I'm going to get you in for an MRI scan just to check your brain and have a good look at your spine. Okay, and I'm also to check out your neck all the way down your spine and in your head as well, which will be really good for the migraines. Okay, that's that. That's just a precaution. Okay, you can have MS and fibromyalgia, but I am just thinking it is the fibro. Okay, but I need to be sure. Okay, so I'll get you in for that. I will book all that and you'll get a letter through. Okay. I also want to send you to a nerve specialist. Okay. I want them to have a look at your wrists, see if you've got what we call carpal tunnel. Okay. It's more than likely to do with the fibromyalgia, but I want to get that looked at. Okay, just to see, especially because it has gone on for quite a while. Okay, so here's some information leaflet on carpal tunnel, just to be on the safe side. And what they will do, they'll probably put you through to see a specialist to see if you can have a wrist restraint. Okay, so an orthopedic specialist. That might help a little bit. Okay, so I refer you to one of those myself, get that measured up and see if you get a bit of relief with the wrist restraints. Okay, they'll measure and do a few little tests and get the right one for you. Okay, so that's that. Obviously, and then you'll have your nerve test for the carpal tunnel, MRI, check out for all sorts of bits and bobs. Okay, but today's diagnosis will be chronic fatigue syndrome and fibromyalgia and chronic pain. Okay, I will see you again because I want to tell you the results from the MRI, the blood test results, the carpal tunnel test, and I would like to have a chat with you after you've seen the orthopedic specialist as well. Okay, I'm also going to issue you a prescription. Okay, so I want to give you some morphine. Okay, I'm going to give you some naproxen. Okay, and I'm going to try you on some pregabalin. Okay, just a low dose to start with. Okay, hopefully within about 4 to 6 weeks you'll notice the difference on the pregabalin. Okay, naproxen is going to help with any swelling and migraines as well. Okay, and morphine is pain relief. I will put on all the instructions how to take it. The pharmacist will tell you about that. Okay, so that is your prescription. Okay, please get that and we can discuss all that when I see you again. Okay, we'll write all this to your GP, okay? And they will probably request an appointment and then sit down with you and have a good chat. And don't worry, I'll sort all the psychologist side of things out as well. And we'll get that sorted like I said, okay? I would recommend that you possibly do some gentle exercising, okay? Make sure you have plenty of fluids, balanced diet. Regular massages will be good, okay? Possibly some acupuncture, reflexology, aromatherapy, okay? There possibly some self-help. Just to finish off, my love, do we have any questions? I know it's been a lot to take in today. Done quite a lot of, little tests and things and a lot of questions. But just wondered if you have any questions about anything I've diagnosed you with. Okay, please read through those. Do a bit of research. Okay, your doctor will contact you. Okay, I'll recommend actually an appointment. They will sit down with you and have a good chat with you about a few things. Okay, go for your scans and everything like that. Okay, then you'll come and see me and we can have a really good chat about the fibro and fatigue and what your questions are and anything like that we'll go through. Okay, and then obviously I'll go through the results with everything and then we'll go from there and I'll see you again. Alright, well I would like you to take it easy. Alright, just digest everything, do a bit of research. Okay, get all these things done and out the way and we can take it from there. Okay, and when you come and see me I can answer all your questions. Oh, you're very welcome, my lovely. Okay. Well, I'll see you in about 4 weeks. Okay. You take care now. Bye-bye.